Welcome to the MD Edge Daily News for Monday, June 25th. I'm Nick Andrews. Today, we're focusing on diabetes and obesity with news from the annual scientific sessions of the American Diabetes Association in Orlando. Switching back to human insulin could save money. Tracking maternal obesity could potentially prevent CVD in offspring. And evidence mounts for a link between maternal diabetes and autism. But we begin today with research showing that nearly 25% of patients with diabetes use less insulin than prescribed because they can't afford it. The price of insulin has increased by more than 300% between 2014 and 2018. Investigators from Yale University surveyed 199 patients with diabetes regarding their insulin habits. Slightly more patients had type 2 diabetes than type 1. In the survey, 6 questions were key. Those questions asked patients if they used less insulin because of cost, tried to stretch insulin, took smaller doses than prescribed, stopped insulin, did not fill a prescription, or avoided starting on insulin. The researchers report that 51% answered yes to one of those questions. Compared with other patients, those who answered yes were more likely to have a hemoglobin A1C level above 9%. Darby Herkett is an undergraduate at Yale. Ms. Herkett said that these data show a tangible effect and an urgent need to address prices. It's safe to switch many Medicare beneficiaries with type 2 diabetes to human insulins as a way to save money on analogs. This is according to a review of nearly 15,000 patients with Medicare Advantage insurance through CareMore. CareMore noticed that its spending on insulin analogs recently exceeded $3 million per month and launched a program to switch patients with type 2 diabetes to less costly human insulin. They counseled physicians to stop secretagogues and move patients to pre-mixed insulins at 80% of their former dose. After pulling claims data from 2014 to 2016, CareMore reports that in that time, insulin analogs fell from 90% of all insulin dispensed to about 30%. The rise in human insulin corresponded with this trend. Total planned spending on analogs fell to about $500,000 a month by the end of 2016. Spending on human insulins rose to just under $1 million. The risk of patients falling into the Medicare Part D coverage gap, where they assume a greater proportion of their drug costs, was reduced by 55%. The average hemoglobin A1C rose 0.14% from a baseline of about 8.5%. However, Dr. Jen Luo says that he does not believe that this is clinically important because this value falls within the biological variation of most modern A1C assays. Children of obese mothers should be regarded as a high-risk population for endothelial cell dysfunction and, therefore, for cardiovascular events later in life. Maternal obesity has been tied to the development of cardiovascular disease and premature death in offspring. This is according to results from a thematic literature review. Endothelial cell dysfunction is a reversible process which offers a wider opportunity for intervention. In the review, researchers cite evidence linking maternal obesity to adverse outcomes in offspring from a 2013 report in the BMJ that includes more than 28,000 women with more than 37,000 children. In that study, children of mothers who had a BMI greater than 30 had statistically significant higher all-cause mortality and increased risk of hospital admission for a cardiovascular event compared with those whose mothers had a healthy BMI. The review notes that evidence from animal models and emerging data from humans suggest that maternal obesity also creates an adverse environment in utero with long-term programmed detrimental effects of the offspring. The review acknowledges that human studies are lacking. However, there is mounting evidence that suggests that stressors in critical periods of fetal development may lead to epigenetic alterations that could play a role in either upregulating atherogenic genes or downregulating enzymatic activities that guard against oxidative stress. Dr. Mary Noreen Walsh is the most recent former president of the American College of Cardiology. She agrees with the review conclusion that more evidence would be needed to show that fetal programming is implicated in the associations between maternal obesity and longer-term cardiovascular effects. Dr. Walsh says that it's a really good framework based on the animal work that's been done, but we have yet to identify obesity in pregnant women as an independent risk factor for vascular disease in their offspring. It's just an association. This review was published in the Journal of Atherosclerosis. And finally today, longer-term data are providing more evidence of a possible link between maternal diabetes and autism spectrum disorder in their offspring. This is according to data presented at ADA 2018. In this study, researchers followed more than 400,000 children for about 7 years through 2017. The researchers report that about 5,000 children were diagnosed with autism spectrum disorder. The rates of ASD were higher among women who developed type 1, type 2, or gestational diabetes at 6 weeks or earlier, compared with offspring of mothers without diabetes. Dr. Annie Zhang says that possible explanations for the link between autism spectrum disorder and maternal diabetes include maternal glycemic control, prematurity, and levels of neonatal hypoglycemia. Dr. Zhang also notes that this study does not account for paternal risks, breastfeeding, and maternal glucose over time. And that concludes this edition of the MD Edge Daily News. Links to these stories can be found in the podcast description. Follow the most up-to-date coverage of ADA 2018 at mdedge.com and subscribe to the Daily News wherever podcasts are found. For MD Edge, I'm Nick Andrews.